Dr. Yu, at the Glaucoma 360 meeting, you presented a talk on managing the odds. Could you give us a summary of what your presentation was about?
Well, the reality is, in managing glaucoma patients, we have to make some important decisions. And unfortunately, all of our interventions certainly have at least some inconvenience and potential side effects. So what we mean by managing the odds is looking at the patient and really customizing, individualizing the therapy to protect their sight but minimize the impact on their quality of life in the short run. One of the challenges that we find is many times patients are on some type of eye medication, and if they didn't have dry eyes before, once we start treating them with medications, often that becomes more of an issue. And so this year, one of the things we're also looking at are ways to identify some of the common dry eye symptoms and some of the newer ways to try to address them. So it's a real exciting time from the pharmaceutical side. We also have some new information about newer laser treatments and some of the good news and some of the problems that clinicians have to watch out for. And finally, we're also talking about surgery. It's a very dynamic area. We'll show some data that shows a dramatic shift in the type of glaucoma surgeries we're doing. And we'll take a look at why that's happening and also talk about things that are coming down the pipeline that will further help us help our patients.
With all this progression going on with pharmaceuticals and devices, what does it mean to the clinician?
A clinician has a lot more options to help their patients. And the bottom line is we need to keep them seeing, but also in the short run, if we can take away some of the burden of this disease from them, that's also important. And so we'll be looking at all the different options that are available and also talking about some of the ones that will be coming up soon. And for those that we don't have the answers just yet today, that's why we're already planning our meeting for next year, because we'll be back in February 2018.
Thank you, Dr. Iwach. Appreciate your time.